You know, right now there's a big push in preventing people from going back into the hospital after they've had an incident or something. Do you talk to the practitioners about, you know, the best way to do that?
Yeah, the readmission problem, as we call it, is an issue. Unfortunately, the current focus is based on the change in reimbursement because the hospitals don't get reimbursed if the patient is readmitted for the same problem within a certain period of time. But more importantly, of course, we really don't want the patient to have the incident that brought them to the hospital to begin with to happen again. What becomes very important there is the interface between hospital and outpatient care. Usually when patient is sent home from the hospital, that means hospital had done what could be done in the hospital. But if the patient is then discharged into an environment where there is no adequate care, whatever brought him or her to begin with will probably happen again. So at the time of admission, we begin to think, where is this patient going back to? Does he or she have enough support in terms of physician support? Does he or she need an endocrinologist on the outpatient basis, perhaps? If diabetes is what brought them to the hospital, do they have adequate education support? And that planning for what will happen after they go home begins in the emergency room before even they're admitted. And I think that's a good way of thinking about it. And then if you plan it right away and the patient goes home into appropriate support system, the likelihood of readmission is really reduced.